Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we decided we'd speak on adenoids.
Yes.
Wonderful. As a singer, this is important also.
Adenoids is a lymphoid tissue which is based in the retropharyngeal fossa, just the wall of the pharynx, throat. It's a lymphoid tissue everyone has, and lymphoid tissue is like a guard, like tonsils. Tonsils also lymphoid tissue. Same way adenoids.
But why were tonsils always removed for us in the West, at least?
No, they earlier that was fashion. Somewhere in 1960 and around that, like they used to feel that it becomes a focus of infection. In fact, this lymphoid tissue is like a guard. So whenever there is a chance of infection, this lymphoid tissue catches that infection, develops inflammation, and resolves it by taking it in lymph nodes.
So when the doctors saw inflammation, that's when they want to cut it out.
So they thought that it is being inflamed again and again, so it is more susceptible, and they thought of removing it. But now even the ENT surgeons have realized that actually you are creating more complications. So infection has no barrier now. If you remove tonsils or if you remove adenoids, then the infection can directly go to bronchioles and lungs. So there would be no barricade for infection. So adenoids is something which is present in the retropharyngeal fossa, in the sense it is clearly at the junction of nose. Both nasions open in the throat, and there it is located. So enlargement, hypertrophy of this lymphoid tissue leads to congestion and nose block. So children, we have seen children with adenoids, they get their nose blocked at night, especially at night. Especially in supine position, it gets congested, and anywhere block means there would be a congestion of mucosa, and wherever there is congestion and stagnation, there would be secondary infection. So these things follow, and as the throat is like a junction box for opening of nasions, nose, ears, and then the mouth. So in this junction, if there is congestion, definitely this congestion will secondarily cause congestion in the ear also. That eustachian tube which connects throat with the ear, that tube also gets congested, and then it will lead to eustachian tube congestion, then in turn lead to mastoid. It is again a sinus behind the ear. So that mastoiditis and so many complications. So we have seen children with adenoids, they develop so many complications like chronic nasal obstruction, they get middle ear infections or ear pain, and many times we find that their even eardrum gets perforated. So eardrum perforation, what we call chronic otitis media, where the middle ear infection becomes so chronic that continuously there is a drainage of pus. And sometimes if this drainage doesn't occur effectively, it has vicinity to the brain. So it can even become fatal if it is not went out by body. So this adenoids is a simple phenomena. It can be treated conservatively. In homeopathy, we have wonderful remedies where we can treat at a very younger age. We find children, and especially they get a nose block, and typically these children, they just start breathing through mouth because their nose is blocked. So during sleep, like that, they will keep open. Even while talking and all, they breathe through mouth. So this typical adenoids, it's a lymphoid tissue, a simple thing. We have many remedies like Barata muriaticum. It is a barium chloride. Barata muriaticum, it's a wonderful remedy. Even we have one remedy like Aurum muriaticum, which is a heavy metal. Aurum is a gold, heavy metal. So murate of that also is a wonderful remedy. Then we have one remedy is like tuberculinum. Tuberculinum is a nosode prepared from tubercular lesion. So that nosode also helps wonderfully well. But of course, in homeopathy, we don't give remedy on the basis of diagnosis that the child has adenoids and give this remedy. Here what we do is we individualize the person, and depending upon the symptomatology, we match with the remedy. So it can be tuberculinum, it can be Baryta muraticum, it can be Baryta carb, it can be Cilicia, it can be Merxol. So, but these various remedies would be indicated, but definitely it can be tackled with homeopathy conservatively.
How does it work, sir?
See, it works like this. Mainly, what happens, this congestion is again because of the defense. Now, when effect ideal conditions where there is infection, this lymphoid tissue should arrest that infection, confine it to itself, lead it to the lymph node and resolve it. That means there should be healing by resolution, so that there is no scarring or hypertrophy or growth. Means, for say there is infection for 1 week, the tissue gets inflamed, then it is carried to the lymph node, and then it is resolved, and then everything comes to normalcy, everything reverses. That is what we call healing by resolution. So nothing should be remaining there, or there should be no growth. Even tonsils, we see everyone's tonsillar tissue, that is a lymphoid tissue, is active. It arrests the infection, it prevents the further multiplication of bacterial infection, but at the same time it resolves completely, means there is no enlargement or something. But in some people there is a tendency that this fibrosis doesn't resolve, it goes. So there is physical structural enlargement, accumulation of tissue, and there it creates a problem. That suppose the adenoids, they get inflamed, and the inflammation leaves some sort of scarring, a fibrous tissue, and this fibrous tissue, if it doesn't get absorbed, then it creates a physical structure there which will obstruct. And this post nasal obstruction in the retropharyngeal fossa, that is what we call adenoids. In that case, it starts giving secondary effects like congestion in the eustachian tube, then stagnation of fluid. There is no effective drainage. See, our ENT passage, nose, throat, and ear, this ENT passage with internal connections secretes around 2 liters of mucus in a day. But we don't realize it because this is being recycled. So it is continuously under circulation, and see, attached are those sinuses, the maxillary sinuses, the frontal sinuses, and even the mastoids. And these sinuses, they also are filled with mucus. It's like a cavity. And if there is congestion and secondary infection, then occurs the phenomena called sinusitis. It can be pansinusitis, means all sinuses are inflamed, or it can be selectively. It can be frontal sinusitis, it can be maxillary sinusitis. But in adenoids, commonest is mastoiditis. Mastoid sinuses are congested, and otitis media is a known complication. Then I have seen cases where they get foul smelling discharge from the ear, and we have seen the hearing is not affected, but there would be continuous discharge. In some people, even hearing can be affected, and when we treat it accordingly, the discharges come, the resolution comes. We have seen even the fibrosis also resolves and it reverses, and we have seen many people what we call kissing tonsils. Generally, whenever they remove tonsils, the surgeons used to remove adenoids also, because both are same lymphoid tissue. So they would say that in future again it would get enlarged. So when we are removing tonsils, you remove even adenoids also. But it's not easy to remove everything. Some remnant will remain, and that again will bother so much that the surgeon as well as the patient repents for operating it. So nowadays, even ENT surgeons have gone conservative. They also feel that so far as possible, don't go for surgical removal, and conserve it. treat it. We can treat the susceptibility, what they call it, in the form of allergy, so called. So they undertake desensitization, they manage. Then in Ayurveda they give, or in yoga also they give jalaniti. Jalaniti is from one nostril, you inject water, and with the gravity you vent it out from the other nostril. So that jalaniti also helps. Even breathing exercises help. But the best thing is the lifestyle is very important, especially the sleep. The circadian rhythm, if child is asked to follow, and proper sleep at proper time with proper duration is there, and even digestion is good, then healing in these adenoids is easier. But definitely, even with the voice, when the child speaks with adenoids, one can make out that there is a nasal voice, that nose is completely blocked. That we can see. We have seen even snoring is common in the children who have these adenoids enlarged. So it's like a hypertrophic retropharyngeal lymphoid tissue and nothing else. And it's common, and every throat has this lymphoid tissue.
With the treatment, how long does it take to heal?
See what happens. In treating this, there are grades of adenoids. Like if the adenoids is at functional level, that for a while it gets congested and then it comes back, then the treatment would be very quick. It would be like within few weeks. But if it is a chronic thing, where there is a lot of fibrosis accumulated, if structural phenomena is there which has established, in that case it may take months or even some years. And then more than that, if the child has secondary complications like otitis media, where there is a discharge from the ear, then that complication, again we have to primarily get rid of these adenoids, and then release the congestion in eustachian tubes, and then take care of middle ear, where there would be no congestion, there would be no secondary infection, and whatever pus is there, it should be drained off properly, and then it should be maintained sterile. So it may take a few years, but it no other way. We have to go for it.
So there is no more any recommendation for surgery.
Nowadays, even ENT surgeons are convinced that surgery is not the solution at all. Earlier, though, it used to be fashion. If the child is not growing, physical growth is poor, they used to say remove tonsils. That is the cause of stunted height. Then if you have otitis media, like ear discharge from ear, they would say it's because of adenoids. And even if it is just marginally hypertrophied, they would undertake tonsillectomy and these adenoids to be resected. Empirically they used to do it, but nowadays even ENT surgeons have realized that it's not the remedy at all, rather it is more harmful.